Okay. Can you tell me, as a practicing medical doctor, um, the kind of the push-pull tactic of medicine and health insurance?
It's quite complex actually, but the most important thing to know about this is in healthcare you are no longer the customer. The patient is no longer the customer. uh, the hospital gets paid from the insurance company. So they don't really care about what you think of their service. They only care about how to package this so that the insurance company pays them. Okay, so it's like you're just a participant in this process, but you're not actually the client. So whether you get better, whether you're impressed by the service, the doctor and the hospital don't care. They just care about what the insurance company thinks. On another level, the way insurance companies work is that they get a certain copay or percentage from whatever medical bill that you end up getting. So the hospital benefits from you having a very high bill because they're going to get that money from the insurance company. But actually, the insurance company itself also benefits from that bill being high, because what the insurance company ends up making is, say, 2% of the bill. So they want that bill to be higher. And so if in most people their insurance doesn't cover everything in the bill, the copay that they end up paying is just so high because it benefits both the hospital and the insurance company for their bill to be expensive.
So, just like earlier with the money problem, how do we get out of that?
The reason the system is so big is because, again, it's centrally planned. There's just the biggest payer for insurance in the US is the US government, through Medicare, through Medicaid, through Social Security. So uh, dismantling this enormous government through, when you stop powering them with their US dollars and instead go into Bitcoin, this will just make that system a lot smaller, so that we then go back into a system where you pay your doctor directly. And when you pay your doctor directly, which a lot of clinics are starting to do, you are liable to the patient, and you want what's good for them, and that attracts more of these patients to you. Patients want to come to the doctor that actually cares about them rather than just cares about having the insurance company be happy.
That kind of makes sense. I do psychology, and a lot of psychologists will just rather do self pay instead
Yes.
of, yeah, and they love it. They absolutely love
Yes.
it because they don't have to mess around with the insurance.
It's a messy game. It's a really messy game, and there's a clinic in Oklahoma. It's called the Surgical Clinic of Oklahoma or something like that. That charges people a fixed rate for a procedure. It's, a hysterectomy is $5,000. That's it. Even the complications, they would pay for it afterwards. So in that way, the doctors are favored not to have complications, and at the same time, you as a patient know what you're signing up for. And if you don't like the surgeon, you're gonna give them a bad review and people won't come back to it. You're not forced to use that physician because your insurance company tells you to do so, because in most cases that's how doctors get business, is through their insurance companies. And
Do you? Yeah, it's like, do you accept my insurance? That's how we find our doctors. Find doctors
exactly.
in our network.
And yeah, doctors, hospitals have contracts with insurance companies, and hospitals have certain contracts with certain companies, and it's just a mess. It's not a free market.